Welcome to the 8-Minute Rule podcast, where actual physical therapists share clinical pearls designed to create conversation around what's getting results in the clinic. No fluff, no Medicare stopwatch, only quality content. Welcome back to the 8-Minute Rule. We've got the whole crew here with Lucas, Drew, and Mark, and we are going to kind of go over a little topic that many have some awareness around, kind of generalizing versus specializing within physical therapy. So I've got some quality clinicians that have really gone through a lot of different routes, whether specialization as well. And so with a lot of information to talk on. So first things first, though, nice little icebreaker question for you here. So let's start with, what is your coffee order? Lucas.
Black.
Gonna be fun.
Once a week, I go with whatever the struggle bus. So shout out to the struggle bus if you're near Winston. They're awesome. Whatever their sweetest and most flavorful thing is, they have these specialties that are awesome, but I can only do it once a week. Other than that,
A frappa, silly Gino. Love it.
yeah. All the sugar and all the dairy. Love it.
Jordan, you keep asking these questions, and I keep saying, like, I don't do this or I don't do that. I don't drink coffee, so I don't have a coffee order. I will say that I do drink an espresso shot just for the caffeine, but like I don't enjoy it, and I don't necessarily notice the benefits of caffeine, but I know there's research to support the benefits of caffeine. So there you go.
That is for another episode, Mark. But thank you for leading us into the future. So, all right. So we'll jump straight in, really trying to look at this conversation around generalizing versus specializing. I love having you guys on because you work in a very differing set of clinics to some degree. So really we're kind of looking at it. I think you'll hear a lot of times, go work and be a generalist first and then specialize. And I guess we're kind of here to talk about it. Is that really beneficial? I mean, Mark, throwing it out to you. Is there benefit to generalizing earlier and then specializing in the future, especially in your more sports-focused clinic?
I think the answer is yes. I think getting out of DPT school, like most of us, if you have a similar experience to me, don't really know what the heck you're doing. And so creating a very strong foundation in orthopedics and getting a good concept and good application of both patient management strategies as well as applying the concepts that you learned in PT school, I think that's always going to be beneficial. And then, if you're going to want to work with sports or athletes at a high level, like, it's probably a good idea to start to treat more of that population and become a little bit more focused on some of the con ed that you're taking. Part of that is that if you want to work with elite athletes, you also have to have connections and then like the experience. If you don't have those things, you're not going to end up in those places. And that's pretty well true across the board with elite athletes. Do I think that a very solid orthopedic clinician couldn't work with athletes? No, I don't think that's true. It's taking application of concepts and applying it to a different population based on their needs and what they need to be able to do for their job, or in this case, their.
So Drew and Lucas, I'm interested to get your take on this as well too. I mean, you guys, like I, have started a clinic in areas where there was already PT, and so you're kind of working into that. So what's your take? Generalist for specialist, like when's the timing, when's their value? Drew, you look like you got some thoughts. Fire away.
Well, real talk, I was trying to mute my Teams because I forgot to turn that off, and I think I caught most of it, so I hope I don't repeat anything. But I'm largely in agreement with the focus early on needs to be that framework, clinical decision making, and it's going to be similar no matter where you go. But depending on what your goals are, I think it makes a lot of sense to start working towards whatever that end goal is early on. Like, where you start is where you end up. We kind of know that principle in the medical world of, if you start in conservative care, you're more likely to end up in conservative care. If you start talking to a surgeon, you're more likely to have surgery, really, no matter what that condition is. So if you want to have an ultimate goal of, hey, I want to work with athletes, or, I want to work with, think of some of the others, runners. I want to work with, the big one is a lot of people in ortho want to do sports. I'm even trying to come up with some different ones now of concussions or vestibular. Like, start working with those populations and start gaining the experience because there are nuances to a lot of different populations. And while there's benefit to having a much more general picture and base, where you start is where you could end up. So making sure you start off somewhere that either has those populations or is going to support you in helping build that population is going to be good for your long-term career.
I'll take a side path here. You come out of
As
school,
I'd expect.
you're at a different pace. Your mentality is different. You came out of a lot of studying, a lot of reading, boards testing. You had a lot of pressure on you to finish that program and to get your license. I think the first 6 months a year, it would be beneficial for most new grads to go generalist because that's the moment you learn to develop that or redevelop that empathy towards people in pain, towards not so focused into I need everybody to get better as fast as possible. I need to show that I can do this. I need to show no, slow yourself down, take care of people, listen, learn to listen, slow your metabolism, take care of them like you mean it. And I've had the new grads that had some of the best feedbacks from patients I've ever seen, even in considering specialists. And then if you have a passion or develop a passion to something very specific, then you follow that path. I've had new grads coming in saying they were going to be going to residency and do specialization, and they had a change in heart and ended up in home health, and they love doing that. You know, I think kids these days, the world these days is too fast, and majority of our patients doesn't need that energy. They need more empathy. They need more a call to care, if you will.
I can agree with that. And I would maybe push back a little bit, Lucas. Maybe the most important thing there is having a good mentor, somebody who can teach them that no matter what that setting is.
Yeah, and I think that's one of the things that continues to strike me as I think through this. I mean, the reality is, if you go into residency, all three of you guys did, and you went into fellowship. I mean, that is specialized. Like, you guys are very specialized clinicians. Now, it's also within a general of orthopedics, but again, but that is a specialty niche, right? Like, you could have gone in neuro, could have gone in geriatric, like you could have gone in pelvic. You go a lot of different directions as this pertains. And so, I'm just trying to think through, Mark, for that clinician that wants to go be the PT for the Dallas Cowboys, how much value is it for them to see a high Medicare population, maybe not a high Medicare, but a Medicare population early on, as opposed to saying like, hey, I know what I want to do is to work with athletes. I need to find, as you said, that mentor that's going to work with me right now and start really being able to work with that patient. So, I guess the dichotomy between getting started, if you really know what you want to do, getting started to go that direction versus if you have a little bit of ambiguity in what you want to do, kind of working for more from the general. Any more thoughts on that? And feel free to push back.
I'll counter that a little bit. I think that working with the population that is different than your necessarily focus will challenge you in ways that you may not expect and ultimately prepare you for the unexpected in the future as well. I think that also in the sports world, in a sense, a lot of times it can become very elitist almost. And I think working with a population like a more higher Medicare percentage can very well humble you early and teach you some very valuable skills and empathy and otherwise.
That's exactly my point there. Mark, you nailed it. I think people don't realize how certain specialties, especially the sports world, can be ruthless.
I'm kind of hearing the sentiment of it almost doesn't matter where you're at. Learn the skills that you need to in each situation. Because as somebody who does a fair amount of hiring, one of the things I'm going to look for is if I am hiring here is like, how are they doing in this? Are they learning? Have they developed a framework? Because my guess, I don't work with a lot of athletes. And if I go to work with a bunch of athletes It woof take me a little bit. Anytime you learn, like, first you have to learn to be good, and then you can learn to be more efficient. And if I go and work with a bunch of athletes and I need to start picking up new pattern recognition, it's going to be a little bit slower, but I've done it before and I know how to do it. And I'm probably going to start picking that up more quickly because I've been through that process. I've been through the fellowship where things slowed way down for me. Like, I felt the most inefficient I ever have after 5 or 6 years. And then it started to pick back up. You started seeing these patterns, and I got way better at it. And I mean, if I would interview with Mark, I would hope that he'd be like, okay, he's been through that. He knows how to do it. He's going to start picking up on these. So no matter where you're at, really learn kind of how to learn. What are the things that you can learn for your overall career goals? Now I'm like contradicting what I said earlier. I think it's best to start, if you want to get somewhere, but no matter where you're at, make the most of it and learn all you can and still have that career end in mind, whatever that goal is.
I love it. Quick question on this as well too. So, I can't help but think about now the picture of that 5-year PT. Hopefully they've built out a good foundation, had some good mentorship. Now, when they're looking between, all right, do I want to continue to maybe go into fellowship and really broaden my horizons of really expanding my generalist to some degree versus, like I know Mark, if you're interviewing PTs, a 5-year PT, I would imagine in your clinic, they need to be pretty good at handling athletes, correct? They need you more than likely hire somebody specializing. I think Lucas, one of the big things that's helped you be able to grow clinics is your TMJ specialization. That's not something that everybody has. That's something that you've gone and found and has created a niche for you to really be able to generate a lot of referrals and conversations there as well too. So advice to that 5-year clinician on what they want to do. I mean, anybody got any thoughts on that? Did I stump the panel?
No, and I don't think I will circle back to what I was saying, and Mark reinforced later is like once you build that empathy, once you build that learning skills, once you fall back into a day-to-day speed of life, you will recognize where you want to go. Then for by all means go ahead and dive in full speed ahead. But don't try to do that right off of college. Slow down, go generalized first, and then you maybe get into that route. This 10 minutes conversation here actually brought my question to my head. Well, like with the rates of burnout in our profession, I asked myself like, what is the burnout mostly on specialists or generalists? And I don't think there's a research of that about it.
Yeah, I think that's a really good point. Kind of looking at both those things. My guess is it's on a lot of people that either in certain systems they can't thrive well in, whether they're not getting the results they want or things just don't blend well for it. And it could be mismatched too, right? You could be somebody that's going to thrive better in a different environment than the one you're currently in, which is good. So I think what I'm hearing as well is that you still got to stick with foundation. There's a ton of help. I think
Yes.
Mark, what makes you excellent in treating athletes is you had a good foundation before, and then you really built upon it with the high athletes. I know you didn't start in a high athlete clinic. Lucas, obviously, TMJ, you got to be able to treat the neck really well. I know you do, and so you build the foundation up there as well too. And so, I think as you said, having that good foundation is the start. But then I do think it's helpful. Know what you want to do. Know where you're going to thrive. Know the population that you want to work towards, because
So
at some point
what
you're going to need to work that way too.
what nobody knows is my first career was in a professional volleyball team. There are 3 of the girls I worked with that are gold medalists in the Olympic Games. That in itself taught me that I did not want to be in that world, actually.
Cool. Well, good stuff, guys. Appreciate the insights. I appreciate the thoughts here. Hopefully, it was some good content for everybody listening. I look forward to seeing everybody back next week.